It's another day with your fertility specialist. On behalf of Alps Hospitals, we love to say a very big thank you to our dear viewers. Thank you for liking our post. Thank you for sharing. For this session today, I'm your host, Ruth Ogogo, and I'm always excited to be with you guys every Wednesday or Friday, as it may be. So today we're talking about PCOS. That's really a serious condition to talk about. But before we talk about it, we have Dr. Ken to do justice to PCOS with us today. Dr. Ken, it's good to have you with us. Dear viewers, for someone watching for the first time, just a bit about Dr. Ken. He's a consultant gynecologist, he's a minimal access surgeon, he's a fertility specialist, an IVF specialist. He pioneered laser gynecological surgeries in Africa. Just a bit about Dr. Ken. There's more to him, but for now, let's focus on PCOS. Dr. Ken, once again, you're welcome.
Yeah, thank you, Ruth.
So as we get started, viewers, drop your thoughts, your comments, your question in the comment section. Share this link with someone, call up someone, because PCOS is a very, very serious issue that needs to be talked about. In fact, before we came before we came on air, I tried checking statistics and I saw that about 10 to 20%, some authorities have it 10 to 13, some say it's even as high as 26% of the population of women that are dealing with PCOS. I'm like, that's a lot. That's a lot amongst the population. So, and then I'm sure some other percentage are dealing with a lot. And then they said 70%. I don't even know how they got their statistics, because if it's not diagnosed, I wonder how they have the statistics then. About 70% of people are not even diagnosed and they have PCOS. So
Yeah,
this is a lot, and this is a condition I think is something really worrisome, and it's something that is becoming common. It seems to even be on the increase. So people might also be wondering why or what is PCOS. Maybe we'll start from there before you tell us a lot about this condition.
yeah, quite a number of people are actually not diagnosed. I see a lot of people who have seen quite a number of doctors,
Yeah.
gynecologists inclusive, and they have all the symptoms and all the complaints and features of PCO, but haven't still been diagnosed of PCO. As as close as yesterday,
Wow.
yeah, I saw someone, single, with PCO, and I didn't know classically that she had PCO. So India has one of about the largest burden of PCO in the world. India, you know, and PCO is everywhere. Actually, it's everywhere. So a good number of people have it, but because it is in degrees. For instance, you have four phenotypes of PCO:
Yeah.
phenotype A, B, C, and D.
Okay.
You know, A and B seem to be the milder form, and
Okay.
phenotype C, D are the advanced form. So those in the milder range just may live their normal life
All right.
and go undiagnosed because they could just have everything as easy as they want or as easy as nature could permit.
Yeah.
Why the other extreme CD phenotype, according to certain uh, classifications,
Yeah.
may have things a lot difficult. So, did you ask what PCO is?
Yes. Yes, but it's good you're telling us
Oh
all this.
yeah. So
Yeah.
so PCO. When we were in the medical school,
Yeah.
PCO was like an enigma without a clear-cut definition. You just use signs and symptoms to make
Symptoms.
definition of PCO, but the world has advanced. And science is not left behind. And PCO now seems to be a combination of all kinds of factors. So it's a combination of genetic, you know, uh, metabolic,
Wow.
yeah, and even physical conditions affecting the ovaries of women that
See.
can manifest with as problem with ovulation, problems with menstruation, and with respect to menstruation, the problems could be maybe a prolonged interval of menstruation, as in you could go 2 to 3 months without having menses, and then they could have abnormally long menstrual period when the mens decides to come. You know, so and then it goes with uh, problems with ovulation. They don't ovulate,
Wow.
and then because of that, they have problems with fertility. When you don't ovulate,
Yeah.
you don't have fertility prospects so easy.
Precisely.
Also, as part of the problems, they have what they call the problems with their hormones. Yes, there's certain kinds of hormones that seems to be irregular, abnormal with PCO. You
Wow.
know, one of the hormones is what we call the luteinizing hormone. It goes so high and makes the body feels like the body has ovulated because in a normal woman, the
Yeah.
hormone is high when she's about to or has ovulated.
Oh,
But
okay.
then for PCO, it's just high from the beginning of the day. And so it confuses the body, confuses the brain, and even when ovulation is about to happen, because it's so high, it affects the quality of eggs. You know, so that's why you hear the word often. Doctors say I have hormonal imbalance.
Yes,
That is
that's
what
a
the regular
common word.
doctor describe PCO as
Yes, it's
hormonal
true.
imbalance. So when you begin hearing hormonal imbalance,
Balance,
just
yeah.
know you may be dealing with PCO,
PCO.
and count the number of women who have been told
Yeah.
they have hormonal imbalance.
Imbalance.
That's African colloquial description
Exactly.
of
Yes, it's a
polycystic
very common thing
ovary.
that
By the way,
people.
PCO means polycystic ovary. Then PCOS, PCOD, they're all the same. Polycystic ovary syndrome or polycystic ovary disease. And that's when to say all the symptoms together with the laboratory findings and the ultrasound findings are pointing towards this abnormality. So it's
Wow.
polycystic ovary disease, polycystic ovary syndrome. So then they could have metabolic, I say it could be metabolic, sugar metabolism, and then they could have problem with blood pressure later in the future. And it goes with obesity for some people. But of course, we have a category of people called the lean PCO. They have PCO, but they are the skinniest people around.
Wow.
So PCO is not just for the it's not it doesn't just come in as shows as an obese, I mean, for an obese person, but you could be very lean and have PCO. So the
PCO.
lean PCO. So PCO, just, you see, from all I've been trying to describe,
Yeah.
you see, it doesn't appear to be making sense even to me.
Well, you're giving us a very broad
you,
in
you,
depth,
you,
so
you,
people are
you,
able
you you
to.
understand? So these are all the things that you
Yes.
find that that describes PCO. Obesity is there. Then for some people, because of elevation of the male hormones,
Hormones.
they could have what we call excessive hair distribution, like
Oh.
looks like male pattern of hair distribution.
Wow.
So you
Wow.
could have the beards, mustache, then
Mustache.
the hair on the
Wow.
chest, then the pubic hair will look like a male pattern
Wow.
of pubic hair. So they could have hair all over the body, in
The
the
body.
arms,
Wow.
everywhere. So we call that hirsutism.
Wow.
So these are all grades and shades that PCO comes
Comes
with.
with.
Then for some, the sugar abnormality, that's why it calls it a metabolic condition. And genetic condition means it's transferred from mothers to their kids.
It's wow.
Yes, mothers to their kids. I've seen generation of grandmother, mother, daughters all having PCO. And they all came to my clinic in one day.
Wow. Wow.
Grandmother came in support of her daughters who are trying to achieve pregnancy and have been diagnosed with PCO. And she said she had similar thing, you know, yeah,
Wow.
growing up. So this is just bits and pieces
Of it.
of what PCO may look like. Also, it's good to mention that some people could be PCO and they don't have any of these symptoms.
Symptoms. Wow.
And then they could be having their deliveries as easy as possible. They
Possible.
menstruate every month the way they should menstruate and all of that. No complications. So I guess those would be the phenotype A categories of PCO. Yeah.
So, viewers, Dr. Ken has just made us know that PCOS is just one hell of a complex
Yes.
condition. Like, imagine all the things he listed. You can't even pick one. Like, they are just so numerous, so many issues. Is it ovulation issues? Is it irregular periods or the generalized hair? Like, okay, looking like the male. I mean, it's just a lot.
Let me add something to this.
Yeah,
You see, in my own way, I like to describe PCO as a condition. I mean, with respect to reproduction
yeah.
now, as a condition where you have so much, but yet you're starving.
Hmm.
How do I
Wow.
mean? If you look at the antral follicles, for instance, of those having
Yes.
PCOS, by the way, antral follicles are those tiny cysts that surrounds the peripheral part of the ovaries. They could be
Ovaries.
scattered around the ovaries. You see that when you do ultrasound scan. So then in the book, they say you have a pear-like arrangement of
Okay.
all of those cysts. So means many, cyst,
Many.
polycystic.
Oh,
Poly means
oh,
many in
oh,
mathematics.
yeah,
Cysts,
yeah,
tiny, tiny antral follicles. They are
yeah.
everywhere. And
Wow.
usually, when you see that as a gynecologist, for a regular woman, you are happy because, I mean, as a reproductive gynecologist, you are happy
Yes.
because you feel if I give this woman medication, she could produce good eggs.
Mm.
So in the PCO guys or ladies, you're not happy seeing all of that because they have plenty of those, which is a good sign that there could be eggs, but now the eggs are often not in good condition.
Condition.
So that's
Wow.
why I say it's a condition where you could have plenty
Mm.
and then you were starving.
Wow.
You do an IVF for a PCO woman, for instance, and retrieve a lot of eggs,
Yeah.
and then let's say you retrieve up to 30 eggs because they could actually respond with this grave number of eggs, even
Eggs. Wow.
when it's not intended.
Mm.
You retrieve all the eggs, and you may just find out that they're all not good
Mm. Wow.
to make for pregnancy, or very few are good. Or when you get fertilized, you see that fertilization monitoring doesn't just go the way it should go. And that's because, you see, we say the hormone that is abnormal may actually follow through even the process of the treatment to produce eggs, that the eggs comes out poor in quality. Yeah, they produce good eggs too, but not often, especially when you're
Wow.
dealing with the phenotype C and the D
D.
of polycystic ovary. So the doctors need to do a lot for the PCO people to produce few good eggs.
Wow.
So they have plenty eggs, but the eggs often are not too useful. And that's why you see also that now PCO comes along with a lot of miscarriages because the eggs are not too great. Even when on a normal day they have intercourse, have ovulation,
Yeah.
and get pregnant, and pregnancy goes for a short while, and then they start bleeding and they have a miscarriage. And you'll be wondering,
Mm.
why are they always having miscarriage? So PCO
Miscarriage.
causes habitual miscarriages.
I know
There are other
someone.
conditions that could cause habitual miscarriage, but PCO is one hell of a condition that could cause that. So they have plenty eggs. Anti-Mullerian hormone can be so
Hi.
high,
Wow.
which should make a gynecologist rejoice. Yeah, we happy when we see those things, but high elevated I mean, anti-Mullerian hormone in a
Yeah.
woman may be a sign of PCO. Actually,
Exactly.
it's one of
Wow.
the signs of PCO.
PCO.
And then that's one condition where it's high and you are sad. She has
Hmm.
plenty and she is suffering.
Exactly. Wow.
So
This is a lot.
you're in a
It's
what
just
you're
a
in the middle of
twist.
water and then you are thirsty.
Thirsty.
So you
Exactly.
have plenty eggs and you can't conceive.
Oh, this is just so
So
sad. It's just a very, very
it's just not nice.
dicey one. Yeah, so was this is a lot. Should we say PCOS is really something that seems to be scary for someone that might be dealing with it, especially people that have the very severe forms. I was just wondering how early can people pick this, because there are some people that they really never know until maybe when they are now trying to conceive, and there are some that, because I know of someone that as a teenager, I think they had picked it and they had to practically be giving her pills just for her to see her period. So you
Yeah.
wonder how early can people really know And is there really something that can be done even if it's discovered early? Does early diagnosis in any way help people?
Yeah, early diagnosis actually could be helpful, but then what do you really do? Early diagnosis could be helpful. Yeah, I don't like those ideas of those pills anyway. That's me now. I'm not talking like uh like a doctor at this point.
Point,
I'm
yeah,
just
but
talking like a human being, like a regular human being. Yeah, because when you give those pills too frequent, say you want to regularize the menses. You know why you're regularizing the menses? The menses is not important in any case, and making the menses come doesn't change anything, you know.
truly.
Even though as part of treatment for PCO or care for PCO, it's good to make a woman menstruate at least once in a month. So I
Oh,
could subscribe to pills to make a woman menstruate once in a month and once in
oh,
4 months to
oh, okay.
prevent the risks of cancer of the endometrium.
Oh, okay.
That I
Wow.
would. But if a girl is not menstruating because of PCO and she's not about to get pregnant or she's not intending to get pregnant, why make
Pregnant.
her menstruate?
Exactly.
Because it's just somewhere in the head of women that if you don't menstruate, so not a woman. So that's me talking
Yes,
like
it's a
a like
general notion
it's
of women.
exactly so side effects. It makes them add weight and it worsens PCO.
Oh, wow.
Oh, sure. Because you see, the young PCO girls we see in the society today are worsened. The clinical conditions get worsened because of obesity. The lifestyle, the kind of diet, the kind of things they eat, consume,
Yeah.
plenty of eggs, plenty of starch, and all of that
Wow.
gives weight gain. And with the more weight, PCO get worsened because part of the care for PCO is weight loss. Pills may be okay if you're dealing with heavy bleeding following PCO.
Oh,
In that case, you
okay.
could select when to give the pills and
Pills.
high dose of pills for that matter to stop bleeding and to regularize the period.
Periods. Okay.
So care for PCO really just you do for those guys. Some
Just
intervention may just not be necessary,
yeah.
and some interventions could be necessary. So
So, so viewers, that's why even if you feel like okay, you know someone that is PCOS and maybe they've just diagnosed you to have PCOS, you don't just assume that whatever it is they are doing for that person is something that you can just emulate and start doing.
exactly,
You don't just
exactly.
copy someone
The
else's
care for
treatment.
PCO is individualized based on what you want. I saw a PCO lady yesterday.
Hmm.
Yeah, a young girl, single.
Oh, wow.
You know, it's one case that made me sad. Yesterday, the day ended on a sad note for me because
So,
this lady is pretty.
oh,
I mean, if Ken describes the lady as being pretty, a
pretty.
gynecologist, no, she is
She's
pretty.
pretty in every sense.
She's beautiful, you know, and then PCO, and, I started thinking into the future for her,
Exactly.
because what brought you to the clinic is menstrual abnormalities, irregularities, in this case,
Wow.
sporting, continuous sporting, you know. But what
It's
worries
just a
me is
lot.
the fertility prospects,
Exactly.
you know, fertility prospect. And then the kind of intervention at such that I can't discuss with just her because she's single, yes, an adult, but I had to request if she wouldn't mind for me to have a consultation with her and her parents.
Wow.
Oh, yes, because we have to talk.
Yeah.
I don't know if she would have the privilege of meeting a detailed doctor like me again, you know.
So it's good she
So it's
has
good she has to, and some
in-depth
of those
understanding.
decisions, the parent could help her in making some decisions because we had to talk onto reproduction. And good enough, the clinical condition that brought her wasn't very grave, but she's in the C D phenotype kind of PCO.
Wow.
And so I could begin to imagine
Texas.
what the
The
future holds for
progression.
her. So we have to talk of this. So what I'm saying is that care is individualized.
Realized
In our own
exactly.
case, we had no intervention. Yes.
Wow.
Talking and education was
Yes.
the intervention for
For
her,
her.
And we talk up to the point of ovarian drilling, which is the most advanced intervention. But of course, take your time, think about all of this. I'm more careful about the fertility prospect that you have than the clinical situations, which is mild that you have right now, just mildly elevated prolactin and spotting. So the care is individualized.
I
And
see.
what is done for you what may be different from
Different from
what
what
the
is done
next
for
person
another
needs.
person. Mm.
Some other person may just have excessive body hairs and just need waxing,
Mm.
or some medication, anti-androgen medications to help reduce some of those male features.
Features on them. Wow.
Some other person may need ovulation induction to get babies. Some may need
That's
some pills to reduce heavy bleeding, and some may need dieting
wow.
to shed some weight.
Yeah, so I was actually going to ask because does it have a cure? And if it doesn't have a cure, so what are some of the ways that people that actually have it, are there treatments options available for them or ways for them to manage the condition if it doesn't have a cure?
Yeah, incidentally, PCO doesn't have a cure at the moment.
Okay.
There's no cure in the domain of the regular science. It's a genetic condition, and a woman acquires it from her family. I mean, from her mother, and then it's worsened by the lifestyle of the woman.
Okay.
Yeah, work lifestyle, sedentary lifestyle, abnormal eating, and all of that worsens it. So there's no cure. It can only be manipulated, managed. If she's bleeding too much, you control the bleeding. If she's adding so much weight, you control the weight.
Yeah.
If she's not ovulating, you try to induce ovulation. If the eggs are not good, you give her good eggs. Yeah, you give her good eggs if the eggs are not good. Because sometimes no matter what you do, these eggs are just as poor as they can get.
Wow.
No matter the intervention. Those who do IVF will tell you so much about PCO. PCO is just an enigma. Sometimes you do all what you know to do, and it's just that bad.
I was going to ask your challenges with your experience, what your challenges are with PCOS, especially in your IVF treatment, your responses and all.
Yeah. With IVF, for instance, sometimes the guys with PCO have to take egg donation.
Wow.
Sometimes you do all kinds of evaluation, the vitamin D, the manganese, the ovarian drilling, the homocysteine administration, and all of that. And then you just have very fair enough response.
Wow.
Sometimes you have plenty of eggs and then not too good. And sometimes you celebrate success with them, but the advanced ones, sometimes they don't even respond to medication. Yeah, and then what would you now even say combination of PCO with early ovarian failure? That's a terrible one.
Yeah.
So genetic combination. So it has no cure per se, but it just managed based on what is presented at the clinic or what the patient desires at that point in time. So, but the prospect for the cure, we're looking at genetic cure for the future, and that's to say genetic engineering, genetic treatment like CRISPR that edit the genes and take out the genes for PCO, replace with a healthy gene, is a prospect of cure that we have for PCO.
Yes, wow.
Yeah, and I think that would be very nice to see happen.
We hope it comes someday because it seems to be on the increase by the day. PCOS seems to really be on the increase, and it's worrisome actually.
It is.
It's worrisome, probably because of lifestyle.
Exactly. Yes, and for me, those who have PCO, I think they should do their stuff quite early in life. Because another thing again is that you see a lot of ladies who have PCO, they tend to be finer when they're younger. But as they advance in age, this clinical situation becomes poorer or get worse. So I love situation that you have PCO, you get careful about the fertility potential, and have a good discussion with the reproductive gynecologist or reproductive endocrinologist, and figure out what you should do. If you have to bank your eggs, if they are good at that point, bank them, because they're going to get worse, they're going to get bad at some point. So yeah, you see women who have PCO have 2 kids easily, and then they add some age and it becomes difficult. And all you could see is PCO. So yeah, these are some clinical scenario situations that we see. And then you tell them PCO, you say, where did the PCO come from? So apparently when you were younger, maybe your body situation, your hormone systems were all fine, and ovulation axis and triggers were all going so well. But now you've grown a bit older, and also because when you're getting older, the egg quality gets older. You add weight for some people
Older.
after delivering one or two
Yes, it's
babies,
true.
and
True.
then PCO have gotten some fuel to celebrate with,
That's true.
you know. Mhm.
Oh, some fun to celebrate. Well, yeah. So, at what point would you actually suggest? Because some women are just all about the period, and then yes, they are celebrating that they are seeing their period, and maybe they keep trying, trying, trying. They've already told them they have PCOS, and they are still trying. So, at what point, with someone that has PCOS, would you recommend that they actually seek assisted reproduction technology, maybe via IVF?
All right. So at the moment, most of the guys we see with PCO seeking assisted reproduction technology have tried to get pregnant, and the eggs are just not working.
Working.
And then they now come for an IVF, and then it's still the same eggs.
Exactly. That's
It
true.
didn't work with spontaneous conception. Chances
Conception.
are low that it will work with assisted reproduction
It's
technology.
true.
You understand? But then um, I think whenever there is some form of delay
Hmm.
in achieving pregnancy,
Pregnancy.
I think they should just seek for help. The intervention at that point may just be ordinary ovulation induction.
Hmm.
Yeah. Then if that doesn't work,
Work.
then it can escalate. But then it's
Okay.
good to know that when people with PCO come to the clinic, it may just not be that PCO alone is responsible for what they're
From
going through.
oh. Hmm.
A woman may have PCO and the husband have low
Low
sperm
sperm
count.
count.
These are
Hmm.
two
Double
evils.
issues.
Yeah, these are just two bad conditions,
Yeah.
because depending on the category of the sperm and the DNA fragmentation index of the sperm,
Index.
pregnancy
Hmm.
on its own will just be difficult. Adding PCO to it is like
Oh
making
goodness.
situations even
Worse.
complicated.
Yes.
So whenever as a couple they have a delay, they should see the doctor or the gynecologist and get evaluated so that we know whether it's a multiple factor of infertility or a single factor of infertility. And if it is PCO, for instance, only, then of course the woman should be given her best attempt, a best evaluation, best counsel. She
Hmm.
wants to give a try with her eggs, perfect. We give her all the support.
Support
And
and
if at
hope.
the end the egg seems to be the big problem, have ovarian drilling,
Drilling. Oh,
yeah,
okay.
to kind of reduce the stroma,
Oh,
in
okay.
the eggs, I mean in
Hmm.
the ovaries, and
Yeah.
help improve the ovarian hormonal milieu in the body, and
Oh,
help with the ease of response to medication and ovulation, and give
wow.
all the modulating medications like the
Medications.
metformin, the myoinositol, the vitamin D3, a homocysteine
Wow.
medication,
Wow.
and see whether that could improve on the cellular activities
Activity
of the
egg.
eggs.
Hmm.
If that does work, fine. But if with all these attempts it doesn't work, then a good number of PCO guys will do better
After
with egg
egg
donation.
donation. Wow.
Do
Hmm.
better with egg. So you see, that's the prospects they have.
Hmm.
You know,
Yeah. Wow.
yeah. Or in my long practice, I think I've seen a good number of them with phenotype C and D of PCO doing only successful with
Egg
egg donation.
donation. Wow.
Yeah,
Wow.
egg donation. So their response usually unpredictable,
Hmm.
from no response to poor response to
Wow.
excessive response
Yes.
to no pregnancy.
Wow. Wow. This is a lot.
Yeah. So, and I'm sure a good number of fertility specialists who may be listening to this may kind of agree with me, or maybe a little different, from what. But
Yeah.
PCO is always a big challenge.
Wow, a lot about
Always a
PCOS.
big
I can
challenge.
imagine what people that actually have these conditions are dealing with and
More
the
annoying is the fact
struggle.
that they will transmit it to their kids
Oh, I can
because it's
imagine.
genetic. So that's what bothers
Yeah.
me.
Hmm.
I'm trying to be looking at a world or a future where we are rid of PCO. So among the gynecological condition that I dread so much, well, PCO,
Hmm.
endometriosis, and
Yes.
adenomyosis.
Wow.
I
Wow.
don't, I don't like hearing them. Usually, when I see them, I get depressed for a few minutes
Before you pick it up
before
again.
we pick it up and see. Try not to show the depression,
Yeah.
because you have to be strong for the clients.
It's true.
Yeah, you have
It's
to be
true.
emotionally balanced
Balanced,
for the
exactly.
patient. Otherwise, she's looking up to you for help,
Yeah.
and
So
you are getting
you can afford
depressed.
to dampen
So
her
that will
hopes.
make situations go bad for her.
Wow.
Yeah. So
Viewers.
genetic treatment it's the prospect, it's the future. If we have to stem the transfer of PCO from generation
To
to
generation.
generation.
Of course, no mother would want to transmit that as much as they still want to get
Mhm.
pregnant from their ex. For it's not something they'll be happy. So if
Exactly.
that's a way of chopping it off the chin,
Yeah.
I'm sure a lot of people will
Mhm.
embrace that.
Mhm.
We hope it comes soon and we hope
Mhm.
it's really accessible
Yeah.
because such cure will come with a fortune.
Yes. Mhm.
Okay, yes. So, viewers, a lot has been said about PCOS. For someone that might actually be struggling with and you've not gotten proper attention, you could actually book for an online consultation. You could also be physically present at any of the health centers, either Abuja or just to get proper evaluation and get the best of counsel with very high expertise because you're sure to get the best of counsel, best of care if you're dealing with PCOS. We know it's something that nobody prays for, but just in case you found yourself there, we hope that you're able to manage the situation well and achieve your fertility dream. So, Dr. Ken, as we wrap up, do you have something for people dealing with PCOS or our viewers in general just before we wrap up?
Oh, yeah. Why we hope that the cure comes in, I mean, in the short future,
Yeah.
you know, I think those with the condition should brace up, just be strong. It's not a life sentence.
Mm.
Yeah, every situation can be managed so long as you have a flexible mindset. It can be managed. So seek to consult with gynecologists to give you some help, and more importantly, with reproductive endocrinologists who understand the nitty gritty and dynamics of PCO. We sympathize with those living with PCO, and PCO is not a bad sentence. A good number of people are fine with PCO, have kids with PCO, menstrual calendar, and all of that
Right.
perfect.
Mm.
Yeah, and all of that. So then it's good to know that if you have PCO, tendency of having sugar abnormality, diabetes, and hypertension is common later in life. So check
All of
yourself
that on
constantly,
time.
so you don't live with this for long without knowing it.
Yeah.
So you check and get those things treated. But of course, PCO treatment for one person could be different from what works for the other. Good to know that, so we don't so clients or individuals with PCO don't compare
Compare.
notes.
Mm. It's
Yes.
true.
Yeah, they don't compare notes. So I don't know.
That's
That's all about
comfortable.
PCO.
Yeah, so viewers, so my take home for this is do not compare your PCO treatment with that of your friend or whoever, or even your sister. Your sister might be having a higher degree or a lesser degree of PCOS. So the fact it's blood thing doesn't mean it's going to be the same degree. So please do not compare the treatment of one person to yours, like he has mentioned, and let us know that it's individualized. However, just in case you're battling with this, we hope that somehow, some way, you're able to manage this and achieve your fertility dreams sooner or later. For now, that will be the end of the session. It was good having you guys engage us today. Thank you, Dr. Ken, for staying with us.
Anytime.
Thank you for having us. So, for now, dear viewers, we hope that you have a lovely evening. Bye.